Seminar number 5 in Defense of Case Reports. Before moving ahead with study design issues, it is worthwhile making a case in defense of case reports. I completely agree with Vandenbroek, who wrote in the Annals of Internal Medicine in 2001, there need not be antagonism between evidence-based medicine and case reporting. Unfortunately, some inflexible defenders of evidence-based medicine unfairly dismiss the value of case reports, but many forget that case reports are the historical foundation for our medical journals today. This is why some journals, like The Lancet, still accept and publish selected cases deemed clinically important. So why are case reports still helpful? Well, for one, case reports allow important concerns to be reported quickly in the form of a case report. For instance, a new drug that is developed might only be tested in 20 subjects during phase 1 trials, 100 subjects in phase 2 trials, and 1,000 subjects in phase 3 trials before FDA approval for mass marketing. That does not give much opportunity to identify clinically significant adverse events that might occur in just 1 in 5,000 cases. That translates into a huge unrecognized risk once a drug is marketed to 1 million people, since that can result in over 200 bad outcomes that might not have been identified in pre-marketing trials. Post-marketing case reports provide clinicians and scientists and policymakers with valuable information on safety, optimal dosing, and other issues, and thus deserve public attention. How else are case reports still helpful? Well, they provide an easy writing opportunity for juniors. Scholars need to start somewhere, and a case report is an easy way to exercise one's writing skills. Here's a terrific example of a case report that was first authored by a resident in training in the Annals of Emergency Medicine in 2007. So what qualifies as a worthwhile case report? Although I like to think that any clinical case can be spun into a reportable case report, the Journal of Medical Case Reports, yes, that's right, an entire journal devoted to case reports, suggests the following for a case to be considered of publishable quality. A case is a worthwhile case report if it demonstrates an unreported or unusual adverse event, an unusual presentation of disease, a new variation in disease process, presentation of a new or emerging disease, an unexpected event during the course of treatment, or the case report finding sheds new light on pathogenesis of disease process. Case reports can be extremely powerful and the effects long-lasting, as many will recognize in the following cases. Some of these clinical problems are still unresolved and continue to generate debate. Does calcium supplementation in cases of digoxin overdose really cause stone heart as first reported in 1936? Can naloxone cause pulmonary edema? We're pretty convinced that felbamate can cause aplastic anemia from those few cases that were first reported in 1994. If lifamycin containing cocaine is so common, why is agranulocytosis so uncommon? Bob Hoffman's seasoned advice should be followed when thinking about a case as a potential case report. When case reports suggest causation, Hill's criteria should be applied. So who was Hill? Austin Bradford Hill was an English epidemiologist, one of the pioneers of the randomized clinical trial, and one of the first to demonstrate a direct link between cigarette smoking and cancer. Hill delivered a speech in the 1960s that was published in the Proceedings of the Royal Society of Medicine. This speech is a classic must-read. In it, he explains how to recognize and confirm associations in clinical medicine and what criteria are needed to assess cause and effect. This well-organized and extremely articulate speech is useful today when considering whether a case is worthy of publication. It is available for download on our website. The Naranjo criteria are also important to know because they provide a scoring mechanism for evaluating a case in more objective terms. A score greater than 9 suggests a definite adverse drug response, 5 to 8 a probable effect, and 1 to 4 a possible effect. The Naranjo criteria are pretty familiar to pharmacists and toxicologists. Hill's criteria and the Naranjo criteria can be simplified to 4 easy questions we should all ask anytime we are evaluating the merits of a case. Does the timing make sense? Does the event seem biologically plausible? Does the event cohere with the logic of the universe? And have other likely etiologies been excluded? Unfortunately, far too many published case reports do not adequately exclude other possible explanations. And if you feel you have an appropriate case that deserves public attention and a written report, don't overstate your conclusions. A case report can lead to hypothesis formulation, but a case report cannot be hypothesis testing. This fascinating case report is a perfect example where a conclusion is overstated. Patients with a medical history of epileptic seizure should drink Diet Coke with caution. In this case, the patient drank over 9 liters of Diet Coke in one sitting. That can't be good for anyone, whether or not one has a history of epilepsy. So I don't think all with a seizure disorder need to avoid Diet Coke or drink it with caution. They should just drink it responsibly. Case reports are an important inspiration for future studies. In the next seminar, we'll talk about the basic anatomy of different study designs.